Assalamu alaikum and welcome to a new program, Ramadan for Better Health. This program is going to be dedicated to the entire month of Ramadan. We're going to be covering a variety of health topics that are related to the fasting period during the holy month of Ramadan. And welcome to the Ramadan season. It's a very great honor and blessing from Allah to be alive, to be able to perform this very important religious duty in our lives as Muslims. This is a very important pillar, one of the basic 5 pillars of Islam, to perform the month of the fasting during the holy month of Ramadan. So we congratulate you on coming, being alive to continue your life during the month of Ramadan, and welcome again to this program. Tonight, for our first program tonight, we're going to be talking about the subject of headaches. We have a specialist with us. He is a consultant in neurosurgery. This is Dr. Ahmad El-Sharkawy. Assalamu alaikum to you, doctor.
Alaikum salam, Mr. Ali, and thank you for having me today. And I wish for all Muslim brothers all over the world happy Ramadan and healthy fasting.
Yeah, thank you so much for being with us. So we're talking about the headache.
Yes.
Before we get into how headaches are related to the fasting during the holy month of Ramadan, let's just talk in general. Let's start with a baseline of understanding about the headache itself. What is a headache, and what are some of the types of headaches that we have?
Okay, headache, from its name, headache means pain related to the head and the neck. It affects more than 75 people all over the world. I think no one of us has gone without experiencing headache in some point of our lives. We should know first that the brain itself is insensitive to pain, not sensitive to pain, because it has no pain receptors. But the structures and the organs in the head and the neck are the one which have pain receptors. So if there is a problem in these organs, that's which cause headache, like the eyes, like the arteries, like veins, like the muscles of the neck.
Yeah.
Also the meninges around the brain, or the membranes around the brain, may be some source of headache. So headache means pain related to the head and the neck. We have more than 20 types of headache, but the International Headache Society, it is a society specialized only in headache, classified headache broadly into 2 major types. The first type, which is called the primary headache, and this is 90% of all types of headache. And the second cause is the secondary headache, which has a specific clear cause, and this is constitutes only 10% of headache.
Okay, so just to review, the specialists, there are 2 main categories of headaches, primary and secondary, and there's a total of about 20 different types. What are some examples of primary headaches?
The most common type of primary headache is what's called tension headache, which occur in anxious people, which are very tense, which are irritable, and this type of headache is characterized by the patient tells that I have like a band which is pressing over the sides of my head. It is has duration from half an hour to several hours per day, and this headache also should be treated by antidepressants or drugs which cause the patient to be relaxed.
So this is due to emotional stress?
Yes, this is because of emotional stress, but the exact pathophysiology or exact method how can it cause headache is not known till now. So it is called primary headache. That means without an obvious cause.
Okay, so one type of primary are tension or stress headaches.
Yes.
What are some other types?
And this is constitutes about 90% of all primary headache. Many people suffer from headache because of change, sometimes of change of sleep rhythm, some sort of depression.
We have a visual here with a description of some of the types of headaches. Can you talk a little bit about these?
Yes, the first
yeah,
type.
the first I see is tension.
The side of headache is on both sides of the head. The patient tells that I have like a pressure on the both sides of my head. The cluster headache, which is another type of primary headache, is one type of headache which occurs in only 1 to 3 per 1,000 people all over the world, and it is characterized by a stabbing character. The patient tells that like a knife in my eye. It occurs around the eye, and it causes also redness of the eye, and also runny nose on the same side of the headache.
Not blood running from the nose, just
no, just liquid. Yes.
Okay.
And this type of headache has a special method of treatment. He should treat it by corticosteroids or cortisone, besides painkillers. The other type, which is also common and constitutes about or affects about from 11 to 18 people all over the world, is migraine. Migraine means that the headache occurs on one side of the head. It is sometimes preceded by special symptoms like eye flashes, like tingling or numbness in the face or in the arms or the leg. The patient suffers from pain on one side of the head. The pain is pulsing in character, like pulse, like he feels a heart pulse in his head. Also, this patient complains that too much light causes very annoying, is annoying for him. He prefers to sit calm in quiet place and in low too little light, not too
dim or dark light.
Yes. Yes.
Question, Dr. Ahmed. You said that the migraine occurs on one hemisphere. Does it traditionally go to left or right, or can it be either?
No, maybe on the left, on the right, whatever. No special site for him.
Okay.
Each patient is different from other patients, and this type of headache occurs more commonly in women because of some sort of hormonal differences between men and women. This type of headache needs special treatment procedure. The treatment of this headache, which is migraine, is classified into 2 different methods. One method is to abort the attack of headache, and the other to do prophylaxis against next attacks. To abort the attack, we give the patient painkiller. We give him also some drugs called triptans. These drugs also can abort the attack of headache.
Are these, sorry doctor, are these just standard over-the-counter pain relievers like Panadol, acetaminophen, ibuprofen, or different types of?
No, this is one line of treatment is to give the patient is like Panadol, ibuprofen, and other painkillers, and there is specific painkiller for the migraine headache, which is called triptans. This is a certain drug which can abort the attack of migraine headache within few minutes. And another line of treatment is to prophylax against new attacks of headache by some drugs called antidepressants and anticonvulsants. These drugs decrease the activity of the certain areas in the brain which is responsible for introducing or producing the headache here.
Okay, so have we talked about tension and migraine?
This photo explains where the patient feels the pain. In tension headache, he feels the pain like a band around his head. In migraine, the pain occurs on one side of the head, and may produce also pain around the eye, and make the patient annoyed with noise and much light. And the cluster headache is characterized by pain, especially around the eye, and this pain is like a knife inserted in the eye. and accompanied by redness or running of the nose on the same side of the pain.
All right, so a quick review, we said that there are 20 different types, 2 main categories. We just covered primary. Let's move into secondary. What are some of the examples of secondary, and what are secondary headaches?
Yes, secondary headache means we have a clear cause for this headache, and these are about 10% of all types of headache. Headache in secondary type may issue from different causes like head injury, head trauma. When a man is hit by a car like this, he may suffer from headache, but accompanied by other symptoms like bleeding per nose, bleeding per ear, like this. One type or one cause of secondary headache is brain tumors. This headache is characterized by it is progressively increasing in intensity and is accompanied by vomiting, accompanied by the vision become less clear.
Vomiting related to headaches?
Yes. When we suffer, when the patient suffer from vomiting beside his headache, we should take alarm that the headache may be due to serious condition. We should do more investigations and go seriously with the patient to investigate or to save his life.
Okay, Dr. Ahmed, we'll take a short break and then come back with our discussion about secondary headaches.
Okay.
We'll be back after a quick break. Assalamu alaikum. Welcome back to the program. This is a specialized program that we've dedicated to covering health issues related to fasting during the holy month of Ramadan, Ramadan for better health. We've been talking here about headaches with a consultant in neurosurgery, Dr. Ahmad El-Sharkawy. We'll continue the program. Before the break, we had been talking about secondary headaches. We said that there were 20 major kinds or types and 2 main categories. We talked about primary, we got into secondary, and you were explaining that they could indicate a deeper issue, such as trauma or tumors or that kind of thing. Let's talk about, and also, is it correct to say that like changes in your vision as we get older, this can cause headache?
Yes.
And common colds produce headaches?
Yes.
All right. So let's look to some of the treatments for these headaches.
Regarding the secondary headache, we have a cause. So if we treated the cause, the headache will go out. So in the secondary headache, we should treat the cause. If the patient has brain tumor, we should do surgery to extract the tumor. If the patient has brain bleeding, we should do surgery for this patient to evacuate the blood clot or blood collection inside the brain. If we treat the cause, the headache will improve.
Sorry, Dr. Ahmed, you said remove clots from the brain.
Yes.
This is an amazing thing. How do you do this?
Yes. When there is some types of bleeding which occur in the brain due to rupture of intracranial blood vessels, this rupture or this tearing of the blood vessels inside the brain cause the blood to accumulate inside the brain, and there is many types of or many sizes of the blood to accumulate. If the too much blood accumulating inside the brain, we can open a small opening in the skull. We can go through inside the skull and to extract the brain to relieve the intracranial pressure, so the pressure inside the skull, because the skull is a limited place. If we have more blood, or if we have something other than the brain inside this closed place, it will increase the intracranial pressure and will cause the patient to have symptoms. So we open a small opening in the skull to evacuate this blood clot.
Okay.
Regarding the primary headache, which is 90% of all types of headache, like any pain all over the body, we should give painkiller. Painkiller, maybe Panadol, maybe ibuprofen, maybe whatever, any painkiller. And regarding the specific type of headache, if we have tension headache, we should give the patient drugs to make him relaxed, not anxious, like amitriptyline or antidepressants. If we have migraine headache, we should give him some sort of drugs called anticonvulsant drugs. These drugs decrease the electricity or the activity of the brain cells, and this do better for him. If we have cluster headache, corticosteroids or cortisone have a great role in the alleviation of headache in these patients.
So there are lots of remedies to treat these kinds of headaches.
According to the type is a treatment.
So we have certain red flags, certain indicators that tell us that we should be concerned if we have a headache. What are some of these? Earlier we talked about ear coming, blood coming from the ear or
from the ear or the nose after head trauma.
Are these considered red flags?
Yes. The causes of headache ranges from minimal, very mild causes to serious conditions, and fortunately these serious conditions constitutes not more than 5% of all types of headache, but we should look for them to save the patient if he has a dangerous disease or dangerous problem inside the skull. So if the patient suffers from headache accompanied by vomiting, we should do alarm. We should be anxious. We should be alert that the patient may have brain tumor or blood bleeding inside the brain. If the headache occurs suddenly and severe from the start, we should also do investigations to know the cause. And if the patient also has neurological signs like weakness in the arm, weakness in the leg, or speech problems, we should also this is one of the red flags we should investigate it to not to miss a very dangerous cause. And if the patient also have some systemic symptoms like fever or progressive weight loss, this is also one of the dangerous signs we should look for patients.
Okay.
If the patient has a history of malignancy or cancer in some place in his body, we should also investigate and do investigation and do radiation or imaging for the brain, not to have metastasis from this cancer inside the brain. So if we have, if we find one of these red flags, we should also do rapidly more investigations and more workup to define the cause and to treat it rapidly.
All right. So we've talked about the treatments and the causes, the different types, and we promised our viewers that we would talk about how headaches are related to fasting during the month of Ramadan. This is what we've been leading up to. What are some of the causes of headaches during Ramadan while we're fasting, and some of the things that we can do to prevent headaches?
Okay. One of the most common causes of headache in Ramadan is caffeine withdrawal. People who drink much caffeine, like coffee, like tea, when during fasting hours, the level of caffeine decreases in their blood, and this causes headache. So we advise people to gradually decrease their consumption from caffeine the few weeks before Ramadan. And in Ramadan, he should drink strong coffee, cup of coffee, just before starting fasting hours. Also, one of the causes of headache which occur in Ramadan is the decrease in the blood sugar level, which occur due to fasting. When the level of the sugar decreases in blood, especially after having a high, rich sugar meal before starting fasting, the blood glucose level rises rapidly and then decreases also rapidly, and this is the disturbance in blood sugar level is the cause of headache.
Sorry to interrupt you, Dr. Ahmed. We have a telephone call. On the phone we have Dr. Zosar Mohammed. Salam alaikum to you, doctor. Dr. Zosar Mohammed, he's a founder of the Success Institute. Salam alaikum to you, doctor. All right. Yes, thank you for calling in and joining the program. We're talking here about headaches. Can you add a little richness to the discussion about how the brain works?
The brain works by whenever it senses show in your behavior. So, for example, Mr. Coleman, if I look at you and I say, you look very handsome, what are you going to say? How are you going to respond to me when I say, you look very handsome? Are you there?
Yeah, I'm sorry. Do we have a clear line with the brother?
Like, did you hear the previous one or not?
Okay, so we were talking here about headaches as they relate to the fasting month of Ramadan. Were you listening to any of the discussion we were having?
Yes. What I'm saying is that for everything that's happening around us, we can look at it in a negative way, and we can create our own stress and habit.
Yes.
But if we change our interpretation, the feeling and the behavior will change as well. So for every event, there are so many interpretations. It is your choice to choose one that will create a feeling that you like and shows itself in a behavior that you like.
Mm-hmm. Okay.
The opposite is correct, by the way. If our behavior also is positive, like if we are singing or whistling, or if we are reading Quran, or if we are praying, the feeling right away will change. And then life can throw anything at us. And we are going to take it in a stride, in a positive way. And that will minimize the psychological causes for headache and other stresses in your life.
Okay. All right. Well, Dr. Zolcer, thank you so much for calling in to join the program, giving us information from the psychological perspective and its role that it plays, our psychological wellness in headaches. We will say salam alaikum to you. Again, thank you for calling in. This is Dr. Zolcer Muhammad. He's the founder of the Success Institute. We're continue here in the studio with Dr. Ahmed. You were giving us information about the Ramadan and the headaches, and you were saying that we could, if we're caffeine consumers, to gradually reduce our consumption heading into Ramadan.
Yes, it's a few weeks before Ramadan, we should gradually decrease the dose of caffeine we consume, and during Ramadan days, we should take a strong coffee, cup of coffee, just before the starting of fasting hours.
And you said that this was the #1 cause of headaches during the fasting. People who normally consume caffeine all of a sudden stop, right? And the body has withdrawal. Is this what you said?
Yes, yes. We shouldn't decrease or we shouldn't stop caffeine suddenly, because its withdrawal makes a strong headache or very much headache for the patient.
Tamam.
Also, one cause of headache during Ramadan is the decrease in the water content of the body. Because during fasting, no drinking, the water content of the body decreases. The water content of the brain is about 75% from the brain is water. So it is very sensitive to decrease in the water content. If the level of water decreases in the brain, this produce certain chemicals like histamine, which cause headache and causes the fatigue which all of us suffer from during the day of Ramadan. So we advise all people to have plenty of water from iftar to sahur, not to decrease the level of water content in the body. Also, the changes of the sleep rhythm or the hours of sleep during Ramadan, because all people are awake from iftar to sahur. They still wake up till late hours in the night. These changes in the sleeping hours are one of the most causes which cause headache also in Ramadan.
Yeah.
Stress of fasting also
Yeah.
may cause headache in Ramadan.
All right. Dr. Ahmad El-Sharkawy, he is a consultant in neurosurgery. We do appreciate him joining us, opening up the subject of headaches in general, and then specifically about how headaches can be related to fasting during the month of Ramadan. We appreciate you tuning in. We hope you took away something beneficial. We'll be back with more information with the program Ramadan for Better Health. Assalamu alaikum wa rahmatullahi wa barakatuh. Oh.